Have you ever worried about having surgery now that you're over 70? Maybe it's the fear of not waking up from anesthesia or the thought of a long, painful recovery. You're not alone. Surgery after 71 is very different from what it was in your younger years. Your body heals more slowly, your risks are higher, and recovery can take a serious toll on your mind and body if you're not prepared. But here's the good news. There are 7 critical things you can do before your operation that will help you recover faster and avoid dangerous complications. Most people don't know these tips, and skipping even one of them could lead to a setback that affects your independence, your mobility, or worse. So stay with us until the very end of this video. We'll walk you through exactly what to do before surgery, so you can feel confident, prepared, and in control every step of the way. Whether you're facing a hip replacement, a heart procedure, or even a minor operation, this could be the most important video you watch today. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know so I can make a better video for you. Now, let's get started. 1. Get a full health evaluation, not just for the surgery. Before undergoing any type of surgery after the age of 70, it's essential to go beyond the basic preoperative tests. While most hospitals will check your heart, lungs, and blood work, seniors need a much more comprehensive evaluation. Why? Because aging bodies are more complex. Even minor health issues can significantly impact surgical outcomes. Older adults often live with multiple chronic conditions such as diabetes, high blood pressure, arthritis, kidney problems, or early-stage cognitive decline. These aren't just background issues. They can play a major role in how your body reacts to anesthesia, how likely you are to experience delirium after surgery, and how quickly or safely you'll recover. Medications also matter. Many seniors take multiple prescriptions daily, and certain drug combinations can interfere with anesthesia or increase the risk of bleeding, infections, or confusion after surgery. Even over-the-counter supplements like ginkgo biloba, garlic, or fish oil can pose risks if not disclosed. Another crucial but often overlooked factor is nutritional status. Malnutrition is surprisingly common in older adults, even those who appear well-fed. Poor nutrition can slow healing, weaken the immune system, and increase the chances of post-op infections. Mobility and mental function should also be evaluated. Seniors with limited mobility or signs of mild cognitive impairment are more likely to have a longer hospital stay or face challenges in post-surgical rehabilitation. Identifying these risks early allows the medical team to put the right support systems in place ahead of time. What to do? Ask your doctor specifically for a geriatric pre-op assessment. This is a tailored evaluation that looks at the unique needs of older adults. It typically includes frailty screening, measures strength, energy levels, and resilience. Cognitive testing identifies any signs of memory loss or confusion. Fall risk assessment reviews balance, gait, and history of falls. Medication review checks for harmful interactions or unnecessary drugs. Nutritional evaluation screens for hidden deficiencies that can impact healing. The results of this assessment can help your medical team anticipate complications and create a personalized care plan, not only for the surgery itself, but also for the recovery period. Don't settle for the standard "you're cleared for surgery" message. Insist on a whole-body, senior-focused evaluation that truly prepares you for the best possible outcome. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 2. Understand anesthesia risks for older adults. Anesthesia is not a one-size-fits-all solution, especially for older adults. As we age, our brain, liver, kidneys, and cardiovascular system all undergo changes that can alter how the body processes anesthetic drugs. What might be safe and routine for a 40-year-old can carry greater risks for someone in their 70s or beyond. One of the most significant concerns with anesthesia in seniors is the increased risk of post-operative delirium. This is a sudden state of mental confusion that can last hours or even days after surgery. Affected seniors may become agitated, disoriented, or unusually quiet and withdrawn. In some cases, this confusion leads to falls, prolonged hospital stays, or a permanent decline in cognitive abilities. For seniors with early signs of dementia, anesthesia can sometimes speed up cognitive decline. Another risk is post-operative cognitive dysfunction, POCD, a more subtle and long-lasting condition where thinking, memory, and attention are affected for weeks or months after surgery. Studies have shown that older adults, especially those over 70, are particularly vulnerable to POCD, and in some cases, they may never fully return to their previous level of mental sharpness. Factors that raise the risk include pre-existing memory problems, even if mild, multiple medications, a history of strokes or mini-strokes, long or complicated surgeries, general anesthesia, especially when it's not carefully dosed for age. What to do? Before surgery, have a frank conversation with your anesthesiologist. Let them know about any history of memory problems, confusion, or cognitive decline, even if it seems minor. Ask the following key questions. Can regional anesthesia, like a spinal or epidural block, be used instead of general anesthesia? Regional options are often safer for older adults and involve fewer cognitive side effects. Is light or twilight sedation an option for my procedure? Sedation is often less taxing on the brain than full anesthesia and can still keep you comfortable. Will you monitor me for signs of delirium or memory problems after surgery? Some hospitals now include post-op cognitive monitoring as part of their geriatric care plans. Can we reduce the use of anticholinergic medications or sedatives? These drugs are more likely to confuse older adults and are best avoided if possible. An experienced anesthesiologist will tailor the plan based on your age, body weight, kidney function, and overall health, minimizing risks while ensuring comfort. Finally, it helps to have a trusted family member or caregiver advocate for you before and after surgery, someone who can monitor for any unusual behaviors or mental changes and report them promptly. Being informed about anesthesia and advocating for a safer approach isn't just smart. It could protect your independence, memory, and quality of life long after the surgery is over. 3. Strengthen your body before surgery. Think of surgery as a marathon. Your body needs to train beforehand. This is called prehabilitation. Seniors who take a few weeks to improve leg strength, balance, and stamina before surgery tend to recover faster and suffer fewer complications like infections or bed sores. What to do? Ask your doctor about pre-surgery physical therapy. Even simple chair exercises, daily walks, and light resistance training at home can make a big difference. Focus on your legs and lungs. 4. Review and adjust your medications. Think of surgery like preparing for a big race. You wouldn't run a marathon without training first, and your body shouldn't face a major operation without getting in shape either. This preparation is known as prehabilitation, and it's especially important for seniors. As we age, our bodies naturally lose muscle mass, flexibility, and stamina. That decline can slow recovery, increase the risk of post-surgical complications, and make it harder to regain independence. But studies show that older adults who participate in a rehabilitation program focusing on strength, balance, and endurance have shorter hospital stays, fewer infections, better mobility, and improved quality of life after surgery. Even a few weeks of intentional movement can strengthen the immune system, improve circulation, and make it easier to get out of bed or walk after the procedure. This can dramatically reduce the risk of bed sores, blood clots, pneumonia, or muscle atrophy, which are all more common in adults over 70 after being confined to bed. What to do? Ask your surgeon or primary care doctor about a pre-surgery physical therapy referral. Many hospitals now offer prehabilitation programs tailored specifically to seniors. These programs typically include leg strengthening exercises to help with walking and standing post-surgery, balance training to reduce fall risk during recovery, breathing exercises or incentive spirometry to strengthen the lungs, which helps prevent post-operative pneumonia, flexibility work to ease movement and reduce stiffness. But even if you don't have access to formal therapy, you can still take action at home. Do daily walks, even around the house or yard, to build cardiovascular strength. Try chair exercises for your thighs, calves and core. Lifting your legs, doing seated marches, or standing and sitting from a chair repeatedly can build leg power. Add light resistance training with hand weights, resistance bands, or even soup cans. Practice deep breathing several times a day to keep your lungs active and strong. Aim to start at least 2 to 4 weeks before surgery. The more consistent your routine, the better your body will respond to the stress of surgery and the faster you'll bounce back. Don't underestimate the power of movement. Prehabilitation isn't just about being fit. It's about giving your body the best possible chance to heal, avoid complications, and return to a life you love as quickly and safely as possible. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Plan for your recovery before you go in. Recovery after age 71 can be a completely different experience than it was in your younger years. While many people expect to bounce back quickly after surgery, the reality is that aging bodies heal more slowly. Muscles take longer to regain strength, energy levels may remain low for weeks, and the risk of complications like infections, blood clots, or even depression increases with age. That's why thoughtful preparation before you go in for surgery isn't just helpful, it's essential. One of the most common post-surgery challenges for seniors is fatigue. You may find yourself needing more rest during the day, sleeping longer at night, or simply not having the stamina to do simple things like standing for long periods, walking to the bathroom, or even getting dressed. These are not signs of weakness. They are a normal part of aging and healing. Recognizing this ahead of time can help you be more gentle with yourself during recovery. What to do? Start by asking your doctor what kind of recovery timeline you should expect based on your age, overall health, and the specific surgery you're having. Will you be able to walk on your own? Will you need assistance to shower or get dressed? Will you be able to climb stairs? Knowing this ahead of time helps you set realistic expectations. Next, line up the support you'll need. Consider who will be there to help you during the first few days and weeks after surgery. Will a family member or friend stay with you, or would you benefit from hiring a home health aide? If you live alone, this step is even more important. Some seniors benefit greatly from short-term rehabilitation in a skilled nursing facility where nurses and physical therapists can assist with recovery around the clock. Others may only need a walker, a shower chair, or handrails to safely return home. You'll also want to plan meals. Stock up on healthy, easy-to-digest foods, or arrange for meal delivery through a senior nutrition program or a local community service. If you have dietary restrictions, make sure those are addressed in your meal prep. Finally, don't forget emotional support. Recovery can feel isolating, especially if you're not as mobile. Set up phone check-ins, ask visitors to come by, or join an online support group for seniors recovering from surgery. Staying socially connected is just as important as physical healing. By putting these pieces in place before surgery, you reduce the risk of complications, avoid preventable falls or accidents, and give yourself the best chance for a smoother, more comfortable recovery. 6. Watch out for hidden risks like infections and bed sores. After age 70, the body becomes more vulnerable to certain complications that younger people may bounce back from more easily. One of the most serious risks following surgery for older adults is infection, including wound infections, urinary tract infections, and even pneumonia. These conditions can develop quickly and may escalate if not caught early. In addition, seniors who spend long periods in bed or sitting without enough movement are at risk for developing pressure ulcers, commonly known as bed sores. These painful skin breakdowns can lead to serious infections and are a major concern during recovery. Why is this such a big deal for seniors? For one, aging skin is thinner and less elastic, which means it's more prone to tearing or breaking open, especially around areas that experience pressure like the heels, hips, or tailbone. At the same time, the immune system slows down with age, so your body takes longer to fight off germs. Even a small wound can become dangerous if it's not cleaned and cared for properly. What to do? Before you're discharged, talk to your doctor or nurse about post-surgery hygiene protocols. Make sure you or your caregiver understands exactly how to clean the surgical site, change dressings, and monitor for signs of infection. These signs might include increased redness, warmth, swelling, pus, or a sudden spike in temperature. Mobility is also key. As soon as your doctor says, "It's safe," begin gentle movement. Even short, frequent walks, such as a few steps around your room or to the bathroom, can make a huge difference. Movement helps prevent pneumonia by keeping the lungs clear and improves circulation, which helps wounds heal faster and prevents blood clots. It also reduces pressure on any one part of the body, helping to avoid bed sores. If you're bedridden or need to rest for long periods, ask your caregiver or nurse to help you change positions every couple of hours. Use cushions or specialized mattresses to relieve pressure on vulnerable areas. And most importantly, speak up if something doesn't feel right. Many seniors don't want to bother the nurse or doctor, but reporting a fever, increased pain, or unusual swelling early can mean the difference between a simple treatment and a life-threatening infection. By staying alert and proactive, you greatly improve your chances of a safe, smooth recovery and protect yourself from some of the most dangerous post-op threats. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 7. Prepare mentally and emotionally. Healing isn't just physical. When we think of surgery, most of us focus on the physical side of healing, managing pain, regaining strength, and avoiding complications. But for seniors, especially those over 70, the emotional and mental side of recovery is just as important and often overlooked. After an operation, it's common to feel emotionally drained, anxious, or even a little lost. The temporary loss of independence, the disruption to your routine, and the uncertainty of how long recovery will take can all affect your mental well-being. Studies show that many older adults experience post-operative depression, particularly if the recovery is long or if they struggle with mobility afterward. This is especially true for seniors who live alone, are socially isolated, or have limited support systems. You might start to feel like a burden to others or worry that you'll never get back to your old self again. These feelings are completely normal, but that doesn't mean you should ignore them. What to do? Before your surgery, take time to prepare mentally. Speak openly with your doctor about what to expect, not just physically, but emotionally. Ask how long recovery usually takes, what emotional side effects are common, and what warning signs to watch for when it comes to depression or anxiety. Having this knowledge in advance gives you a stronger sense of control. Don't keep your feelings to yourself. Talk to your family or a trusted friend about how you're feeling, both before and after the procedure. If you're worried, scared, or overwhelmed, say so. Sometimes just talking it out relieves the burden. You may also want to join a support group, either locally or online. Talking with others who've been through similar surgeries can bring comfort, hope, and helpful advice. If you're part of a faith community or social club, stay connected during your recovery. Phone calls, visits, or even prayer can lift your spirits more than you might realize. And finally, give yourself grace. Healing takes time, and it's okay if some days are harder than others. Celebrate the small wins, walking a little further, eating a full meal, or simply getting out of bed. Your mindset is a powerful tool in your recovery. Staying positive, staying connected, and asking for help when you need it are just as vital as any medicine or therapy. Now that you've learned these 7 must-know tips before having surgery after 71, take a moment to reflect. What stood out to you the most? Was it the importance of preparing your body ahead of time, or the hidden risks of anesthesia for older adults? We'd love to hear from you. Please comment below and share one thing you learned from this video that you plan to apply in your own life or with a loved one. Your experience might help someone else going through the same journey. And if you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel. We're here to support you every step of the way. Stay strong, stay informed, and take good care of yourself.